My name is Debra Myers. I'm a longtime patient of Dr. Cole here at NYU. And now I'm a patient of Dr. Aubrey Galloway. My heart's been moderately to severely leaking for over a decade or so now. I started having feelings of maybe intermittent fibrillation day to day. One day I was walking, the next day I couldn't walk around the block. Next day I couldn't get up the stairs. Next day, swimming that bears no body weight. You know, I was like, I'm feeling pressure. So I was scared.
I knew that she had a problem with the valve. I knew that the valve needed to be fixed. She was very, very symptomatic. This was not something that could wait, and she knew it. She was in trouble.
Dr. Cole told me that she'd gotten information from her surgeon in Florida that she had seen that this probably wasn't an operable case and maybe nothing should be done. So she was quite concerned. I told him I would call her over the weekend.
I get this phone call on a Sunday. You know, I'm looking at my cell phone, Dr. Galloway Sunday, calls on a Sunday afternoon, you know, and I call back and his wife picks up the phone. She goes, "Oh, he's in the pool, let me get him." I go, "This is Sunday afternoon." She goes, "Yeah, I know, he's a workaholic."
I was able to go over the findings of my review of the echo, that I thought she was an excellent candidate to have surgery and have her valves repaired or replaced. I thought she would do well based upon what I saw in the echocardiogram. She was obviously quite surprised and happy because she'd been given a different opinion. What was encouraging was that her heart was still good, her heart function was good, so I felt very confident if we did this in a relatively short period of time that she should do well.
I was in here Sunday for my COVID test and went in Monday, checked in, met Dr. Galloway as I was checked in, and Tuesday morning, 6 a.m., I was rolled into surgery.
We knew she needed her mitral valve replaced, and she had high pressure into her lungs, which was stretching her tricuspid valve, which was a valve we could repair, which I also did. She had also been in atrial fibrillation, and I recommended that we treat that with an ablation procedure called a Mays procedure to get her out of the atrial fibrillation while we did her valve surgery. We could do that concomitantly, which we also did.
I have every hope and intention to be better than I was before I had the acute breakdown. It was a nice feeling to just sort of have the trust in my doctors to say, if anybody can do it, you guys can. I have 100% faith in Dr. Galloway and Dr. Cole.